With a longer life expectancy than ever before in Britain, caring for older people will put a greater demand on the country's health and social care budget. But new research from Canterbury Christchurch University shows that community singing can have a positive impact on the mental health and quality of life of older people. Robin Ross reports.
It's been said that singing is good for your mind and body, and to prove it, a leading university in the field of arts and health research has carried out the world's first randomised control trial into the impact of community singing on health.
We did find that weekly singing over a period of 3 months had a measurable and significant impact on the mental well-being of the older people that were engaged in this project.
Canterbury Christchurch University has been researching the link between singing and health for 10 years and is helping to build a case for arts on prescription in Britain. Its latest research has been published in the British Journal of Psychiatry and funded by the National Institute for Health Research.
From a health service point of view, from a medical point of view, the findings from randomised control trials are regarded as a kind of gold standard when it comes to evidence. It's the kind of evidence that bodies like NICE will take seriously. It's the kind of evidence that will find its way into Cochrane reviews.
Say hello, hello.
Pimlico Skylarks is a singing group for people with Parkinson's. Here at a conference organised by the university in partnership with the Royal Society for Public Health, they're demonstrating how singing is helping to manage their condition.
Since I've had Parkinson's, I've lost the quality of my voice and the range. But when I'm here, I can sing, and I regain my range a bit, and it just makes me feel young and fun.
It might have some impact upon the release of dopamine or cortisol or other endorphins in that way. And so we might have a means of actually interrupting the very thing that actually is the difficulty with Parkinson's.
Christchurch is also studying the impact of singing on other long-term health conditions, such as chronic obstructive pulmonary disease. The RSPH has formed a specialist interest group in arts and wellbeing to influence government policy.
We've seen the 5-year forward view for the National Health Service saying we need to ramp up public health. So this is really about helping people to promote their own health, to help them to live healthier lives, as well as treating people who have already become ill.
Christchurch is also examining the impact of dance on people affected by dementia. The condition costs the UK economy £26.3 billion a year. The hope is the arts will save the country money by delaying admission into long-term care.
We also thought it was very useful to film the sessions, and that gave us an opportunity to work with research associates from the Health Trust, and they've been looking through the film data and again working towards an observation framework, so very much looking for specific elements of engagement.
To know that there are cost-effective interventions that are possible is absolutely important.
Research is also happening in museums and art galleries to explore how the arts can stimulate the minds of people with mental health issues or dementia.
With the people with mental health problems, they reported making use of the museum gave them increased confidence and it helped them with their self-esteem. And with dementia, 2 museum activities, one touching museum objects, handling them and discussing them, and looking at art and talking about it, both had a higher result, better result than just having a social conversation.
To see somebody who's a little bit reticent, a little bit shy, have a moment of absolute engagement with another person. We as researchers need to be very dispassionate about what we're measuring and how we're taking the data, but it is quite extraordinary. It's a really wonderful project to be working on.
Over the last 10 years, a number of community singing groups have been set up as part of the research, many of which continue to bring individuals and communities together.
All of our projects run as part of the research. They've continued, and I think that in itself is hugely important evidence of the value of this kind of activity.